Aesthetic Medicine is sponsored in part by the Estique Medical Center. This edition of Aesthetic Medicine contains explicit images of the human body for the purpose of demonstrating various medical procedures. The material is intended for adult audiences.
Did you know that 1 out of every 3 men has not had a general physical? Tonight we take a break from cosmetic surgery and focus on men's health. Specifically, we'll take a closer look at the second leading cause of death in American men, prostate cancer. I'm Elizabeth Day, and it's time for this week's dose of Aesthetic Medicine. And welcome to this very special edition of Aesthetic Medicine. Back with us this evening is the founder of the Estique Medical Center and MediSpa in Greensburg. Please welcome board-certified plastic surgeon, Dr. Theodore Lazzaro. Good evening to you, doctor.
Good evening, Elizabeth.
And joining us as well this week is a very special guest. He is the Chief of Robotics in Minimally Invasive Surgery at one of America's premier medical facilities. He's also the Vice Chairman of the Department of Urology from the Mount Sinai School of Medicine in New York City. Please welcome Dr. David Samadi. Thank you for joining us, doctor.
Good evening.
And welcome to our beautiful city.
Thank you for having me. It's a beautiful place.
It really is a spectacular city, and it's a very special event tonight, given that, Dr. Lazzaro, you are doing an unprecedented show in that you are walking our viewers through a very special journey, one that you recently experienced. Let's talk about your journey that led you to sharing this topic of prostate cancer with your viewers tonight.
Well, Elizabeth, I was diagnosed with prostate cancer on February 18th, 2011, and I can remember the date and the time exactly. It was like being hit with an uppercut in the midsection by Mike Tyson. It just took your breath away and left you devastated. But I dealt with this the way I deal with most problems, is to educate myself, look at the various options, and then plan a solution. And that was really the impetus for this show of helping people to look at something and look at the various different decisions that you have to go through and find out what's best for you. But knowledge is power.
Let's talk about the statistics from the American Cancer Society.
That was one of the things that was startling to me. When I started reading about this, and I'm a physician, so I would think I would know a lot of these things, but 250,000 of men are diagnosed with prostate cancer each year. That means 1 in 6 gentlemen will have prostate cancer. And to put that in perspective, 1 in 7 women have breast cancer. Yet we all know a lot about that, and this has a higher incidence. 1 in 32,000 men die of prostate cancer each year. That's an amazing number. So educating ourselves on this and finding out about it is very important. This is something that progresses with age. By age 50, 15% of men will have prostate cancer. By age 60, it will be 25%. By age 65, it'll be 50%. And it still goes higher after that. So knowing what's going on, finding out about how to screen yourself is essential to beat this disease.
Let's start with the general explanation, Dr. Samadi. You're certainly the most renowned physician in your field dealing with prostate care and prostate cancer. So explain to us exactly what prostate cancer is.
Well, prostate is a part of the urinary system. It's attached to the bladder next to the urethra. It's part of the urinary system, and it's also part of the reproductive system. So it's a vital organ for men. It's surrounded by the sensitive neurovascular, or the nerves that are responsible for sexual function. But what's interesting about prostate, unlike any other organ, is the location of it.
We have a slide, I think, on this.
It's located very deep in the pelvic area. It's, again, sits over the rectum, attached to the bladder, then covered by all the nerves. So getting to the prostate strategically is very difficult just by the location itself. And that's why this surgery that I do, which we'll talk a little bit in the near future, is also very challenging. And That's really what it is. Now, prostate cancer is a growth of a cell in the prostate. And as Dr. Lazzaro explained, about 30,000 men die every year as a result of this. And this can be prevented, and we can help a lot of men out there.
And for such a small gland, something the size of a walnut is very problematic for men's health in general.
Well, when you get diagnosed with this and then you're going to treat it and you're going to think about where this lives, I mean, this couldn't be hidden into a more secluded place. So going after it requires some of the things we're going to talk about tonight.
Part of the prostate cancer, if you don't mind, is that it's called a silent killer, which means that there are no symptoms. And that's really, I think, what you just mentioned, is that you really don't know. You walk into my office and you're perfectly fine, as opposed to many other cancer. And that's what makes prostate cancer very unusual. There are no symptoms, there are no signs, and that's a challenging part as well.
The other thing that makes this one especially unusual, Dr. Samadi and I had talked about, is that it affects your significant other. This is the only cancer that affects women. It affects how you are sexually. If you have urinary incontinence, it affects you in the bedroom. So there's other things that go on over and above the cancer that affects your whole lifestyle.
Which is why it's so imperative for your general health to do the proper screening. We're going to discuss that, as well as the most cutting-edge technology that is available to treat prostate cancer. So don't go away. We'll be right back right after this. And welcome back to Aesthetic Medicine. Tonight we're talking about a very important topic, one that will affect 1 in 6 American men and the families that love them. Dr. Lazzaro, what are some of the common risk factors with prostate cancer?
Let's go right to the slide, and we'll see the most common areas. First, as you can see, it's age. And prostate cancer is rare before age 40. It's usually, you'll see it by age 50. As we mentioned, 15% of men will have prostate cancer, and almost every 2 out of 3 cancers that are diagnosed are in people over age 65. But as we mentioned earlier in our talk, you told me that your brother at age 41 had prostate cancer. So you can't be cavalier about this. You have to be diligent and follow this closely. Race and ethnicity. African American have the highest rate and are almost twice as likely to die from prostate cancer as Caucasians. It's rare in the Asians and Hispanic. That's significantly lower. Family history, having a brother or a father with breast cancer doubles, with prostate cancer doubles your risk of having the disease. So you want to be very diligent in your screening with them. But any family member increases your risk significantly. And then other contributing factors, as you can see on here, diet, obesity, and smoking can contribute as well.